The newborn. Assessing the newborn. The APGAR assessment is conducted 1 minute and 5 minutes after birth. This is a very quick way to assess the newborn's overall condition. 5 measures are assessed: heart rate, respiration, muscle tone, assessed by touching the baby's palm, reflex response, the Babinski reflex is tested, and color. A score of 0 to 2 is given on each feature examined. An APGAR of 5 or less is cause for concern. The second APGAR should indicate improvement with a higher score. Another way to assess the condition of the newborn is the Neonatal Behavioral Assessment Scale, NBAS. The baby's motor development, muscle tone, and stress response are assessed. This tool has been used around the world to further assess the newborn, especially those with low APGAR scores, and to make comparisons of infants in different cultures. Newborns are routinely screened for different conditions. Within the first 24 to 48 hours after birth, babies born in hospitals undergo a simple heel stick, and a few drops of blood are collected on a special paper card. Providers test those dried blood spots for a variety of different congenital disorders or conditions that are present when the baby is born. In California, newborns are now screened for 80 different genetic and congenital disorders. Newborns are also screened for hearing disorders and certain serious heart problems using methods other than dried blood spots. Problems of the newborn. Anoxia. Anoxia is a temporary lack of oxygen to the brain. Difficulty during delivery may lead to anoxia, which can result in brain damage or, in severe cases, death. Babies who suffer both low birth weight and anoxia are more likely to suffer learning disabilities later in life as well. Problems of the newborn. Low birth weight. A child is considered low birth weight if he or she weighs less than 5 pounds 8 ounces. About 8.2% of babies born in the United States are of low birth weight. 67% of these babies are also preterm. A low birth weight baby has difficulty maintaining adequate body temperature because it lacks the fat that would otherwise provide insulation. Such a baby is also at more risk for infection. Very low birth weight babies, 2 pounds or less, have an increased risk of developing cerebral palsy. Many causes of low birth weight are preventable with proper prenatal care. Problems of the newborn. Preterm. A newborn might also have a low birth weight if it is born at less than 37 weeks gestation, which qualifies it as a preterm baby. Early birth can be triggered by anything that disrupts the mother's system. For instance, vaginal infections can lead to premature birth because such infection causes the mother to release anti-inflammatory chemicals, which, in turn, can trigger contractions. Smoking and the use of other teratogens can lead to preterm birth. A significant consequence of preterm birth includes respiratory distress syndrome, which is characterized by weak and irregular breathing. Premature babies often cannot yet regulate their own temperature or feed by nursing or bottle. They may struggle to regulate their heart rate effectively and may experience jaundice. They often require care in the neonatal intensive care unit, NICU, until they are as healthy as full-term baby. Infants that have birth weights that are below expectation based on their gestational age are referred to as small for date. These infants may be full-term or preterm, but still weigh less than 90% of all babies of the same gestational age. This is a very serious situation for newborns, as their growth was adversely affected. One study found that small for date infants died at rates more than 4 times higher than other infants. Problems of the newborn. Postmature. When babies are not born by 42 weeks gestation or 2 weeks after their due date, they're considered overdue or postmature. There are some concerns about how long the placenta can function, and most doctors will consider induction for overdue babies. Problems of the newborn, stillborn. When a fetus, unborn baby, dies while still inside the mother after 20 to 24 weeks gestation, or dies during delivery, childbirth, it is said that the delivered baby is stillborn. The causes of many stillbirths are unknown, even when special tests are done to learn the cause. Possible causes include nicotine, alcohol, or drugs taken by the mother during pregnancy, physical trauma, radiation poisoning, Rh disease, and umbilical cord problems. The number of stillbirths in the United States is about 1 in 115 births, which is about 26,000 a year, or 1 every 20 minutes.